Hi everyone, Whitney Lowe here, and I'd like to welcome you to another of our Clinical Insights videos. Today we're going to be talking about terminology, some of the confusing terminology in the massage profession around different types of massage. In particular, we're going to be looking at three terms: medical massage, clinical massage, and orthopedic massage. What are they, and how you define them, and what is it that you're doing when you do these different types of work? Now, the first place I want to start is to look at some broad categories of massage. We can often take the massage therapy profession and break it down into two main tracks. And that first track is what we might call the wellness track. And this is massage that is being used for general relaxation, stress reduction. You might see this done in spas or health clubs or just in a clinical setting where somebody comes to see a massage therapist just for general relaxation. The main factors with wellness massage is there isn't a specific healthcare problem or medical problem the person is coming in for. They're just coming in to get the benefits of relaxation. Now, sometimes people make a distinction between, let's say, wellness massage or therapeutic massage. And then there's this argument, well, like, hey, well, isn't wellness work therapeutic? Absolutely, of course it is. Those terms probably aren't the best way to break that down and describe it. So we're seeing more of a movement towards trying to make this differentiation as sort of a wellness or personal care type of massage versus massage that's part of the healthcare system. So that's what we're going to be focusing on mainly here today, is this healthcare arena of massage. You don't hear this term very much, healthcare massage, but it is sort of the overall area that's used to focus on massage being used for working with compromised health conditions. And this could include a wide array of problems. It might include muscle tendon problems. It might involve car accidents, sports injuries, working with cancer patients, working with palliative care and hospice situations, or working with medically frail individuals. All of those people have one thing in common, which is there is some type of compromised health condition that they're trying to address through massage. So we're going to look at some of these terms that are used a good bit to focus on that. The first term I want to focus on is one with probably some of the greatest confusion around it, and that's the term medical massage. The term medical massage is being used actually quite a bit to sort of replace that healthcare category name. And I think that's actually a pretty good use of that term, because it does indicate that there's some type of medically oriented reason for people using massage. The problem is that term has also been sort of co-opted to mean a whole lot of other things that lend a fair amount of confusion to it. So, for example, if you look on the website for the Mayo Clinic, they actually have a definition for medical massage, and they say that medical massage therapist is a licensed massage therapist who treats health conditions diagnosed by a doctor. And yeah, that happens certainly, that there are instances where people are working as massage therapists and people get referred to them or from a doctor with a particular diagnosis, and they might be doing that type of massage therapy. But that also has a great deal of confusion in it, because it means, let's say, for example, you have two people who have the identical same condition, and you're going to treat them in the identical same way for those same types of problems. One of them was referred by a physician who gave them a diagnosis. The other person came in directly off the street to your clinic for care, but you're going to treat those two people with just the same strategy and the same approach. So if you just define medical massage as that which is diagnosed or referred from a physician, then one of these people is getting medical massage and the other isn't. And that's really confusing, because it's not about what you're doing or the way you're approaching it in that instance. It's about who sent them to you, and did they have a diagnosis when they were sent to you. So that really lends a fair amount of confusion to that term of medical massage. I really prefer people shy away from focusing on that aspect of the definition. There's another definition actually out on the web that's on Wikipedia, which says that medical massage is an outcome-based treatment aimed at treating a particular complaint administered after a thorough assessment. I like that definition. I think that's a pretty good definition, because it's saying what you're going to be doing with medical massage is treating some type of compromised health condition after a comprehensive assessment process, and the main goal is some type of outcome-oriented treatment. It doesn't say anything about, who diagnosed it, who referred it, or whatever. It just says that's what is being done in that particular approach. One of the other big confusions that happens with medical massage is that certain organizations and groups have put a big emphasis on massage being done for insurance reimbursement. And they called this medical massage, saying it's medical massage if you're getting reimbursed by health insurance. Well, then again, you're defining this based on who's paying for it in that instance, not what it actually is. So again, that lends a fair amount of confusion to that. So the term medical massage, to me, still has some great benefits if you focus on it as more of an umbrella concept. It's not about a particular technique or a modality or any one particular way of working. It's about working with someone who has some type of compromised health condition. You go through a thorough and comprehensive assessment to evaluate them and perform a treatment that is sort of outcome oriented, like you and the client decide and determine what your primary goals are for that treatment. And that's what you're going to be doing with your treatment approach. Now, some people who don't like the term medical massage have opted to call this clinical massage. Again, those two are pretty interchangeable in my mind because they're both focusing on the same things. Clinical massage is, again, a term often used to discriminate between the wellness-oriented approaches and those that are associated more with healthcare. Problem with the term clinical massage also is that people say, well, like if it's done in a clinic, then it's clinical massage. But what about somebody who's doing general relaxation work in a clinical environment or in a massage clinic? Is that wellness massage or is it clinical massage done as a healthcare thing? So again, a bit confusing and difficult to nail down, but both of those terms could be used somewhat interchangeably to really define the same sort of approach, an outcome-oriented treatment approach with massage used to address compromised health conditions where there's an outcome-based focus between the client and the patient working together to try to identify what's going to be the best strategies and outcomes for them. Now, another term that I've used a good bit over the years that also comes into play here a little bit is the term orthopedic massage. And I've got this down at the bottom of this little flow chart because it really is a bit more of a narrow focus. It does fall under the umbrella of either one of these terms, medical massage or clinical massage, but it's a little bit different because it really excludes certain other types of treatment. For example, it's really about massage used to treat locomotor disorders. So soft tissue pain and injury problems associated with the movement systems, just like treating, orthopedic problems in physical therapy or orthopedic problems in traditional medical care. The primary focus is on addressing movement system disorders of the muscles, tendons, ligaments, bursa, joint capsules, nerves, all those soft tissues involved, but anything that's limiting a person's ability to move pain-free and have good functional movement, that would be considered an orthopedic disorder. And orthopedic massage, again, would be how you would be addressing that. Like those other categories, though, it's not a technique, it's not a modality, it's not one particular group of things that you do with your hands. It's more of an umbrella term that encompasses a comprehensive assessment and evaluation process, followed by a treatment plan that you generate that's based on good, sound clinical reasoning of the nature of that problem, and then you're going to focus on some key strategies for addressing that. So that's my take on this terminology conundrum here today. Keep in mind, there are no standardized accepted definitions by any particular organization that have become sort of official determinations of these terms. So people are going to use these terms in a lot of different ways. I've given you sort of my take on them, what I think makes some good sense about how to potentially use those terms, but just know you might hear them used in various different ways by different individuals, and that's because there is some confusion around this terminology. I'd love to hear your feedback on this, so feel free to drop some comments or questions in the comment section below. And if you'd like some more information about how to use some effective assessment and evaluation methods to determine the nature of your soft tissue injuries that you might be dealing with your clients, I've got a great little tool for you. You can grab it over on our website at academyofclinicalmassage.com/cheat sheet. It's an assessment cheat sheet that'll help you get some quick answers to the types of soft tissue injury problems your clients might be presenting with. So let me know what your thoughts are on the terminology conundrum here, and we'll see you in the next time.